Okay, so the next thing we need to know about dental amalgam is the classifications. How do you classify different types of amalgam? So the classification can be based on a number of criteria, and I've listed a few of them here. And what I found was that, or what I discovered was, most of these classifications are actually based on the alloy. So what is in the alloy, or how is the alloy formed? Because the mercury is just mercury, liquid mercury there. So most of the differences comes from the alloy we are using. So shape of the particles, that's talking about your alloy. Are they spherical? Are they spheroidal? Or are they irregular? The irregular is usually called the lacquer. Also, you can classify it based on the copper content. So we have high copper amalgam, we have low copper amalgam. Again, this is talking about the alloy. So usually what is seen is that the high copper amalgam has superior properties to the low copper amalgam, and I'll explain why as we go on. Also, zinc content is so based on the presence or absence of zinc. So zinc usually is used as a scavenger. It undergoes oxidization so that the rest of the metals in the alloy are spared. However, the zinc is also responsible for expansion. So dental amalgam containing zinc usually have greater expansion. We can also classify dental amalgam based on the presence of alloyed metals. Is it binary? Are there two alloys or three alloys? Again, this is talking about the the of course the alloy. So binary, we can have something like silver and tin. If it's ternary, we can have silver, tin, and copper. The availability of dental amalgam. Usually, dental amalgam is available in powder and liquid. But of course, this is outdated. It's the old. It's no longer in use because with the powder and liquid, you had to mix with the mortar and pestle. So what is in use now is the pre-encapsulated, where you have your mercury and your alloy in different sections in a capsule. Then it's put in an amalgamator or a vibrator, and it does the mixing for you. So this is to minimize direct contact with the mercury. Next is the setting reaction. So what do we need to know about the setting reaction? It's extremely important. So what happens when we mix our mercury with our silver tin alloy? So our silver tin alloy is our gamma mixed with our mercury. And what do we get? We get gamma 1, which is our silver and mercury. We also get gamma 2, which is our tin and mercury. This is X because X can be 7 or 8, so it's important we note that. And also there's gamma, which is the unreacted silver tin alloy, which still remains. So it's important we note that some of the silver tin is left unreacted after after the whole reaction is complete. And we should also note that gamma 1 is responsible for the for the properties of amalgam or the good properties of amalgam, but gamma 2 actually is responsible for the inferior properties of amalgam. So which is where the high copper dental amalgam comes into play, because the high copper dental amalgam does away with gamma 2, leaving basically gamma 1 and then unreacted or unreacted, which is gamma. So it has superior properties because it does away with this. Now, indications for the use of dental amalgam. So when do we use dental amalgam? In non-aesthetic zones. So you can use it in your class 1 or class 2, but you wouldn't want to use it in your class 3 or your class 4 because we are dealing with anterior teeth and we don't want them anywhere near the anterior teeth because dental amalgam is grayish. It's not aesthetic. And areas difficult to isolate. So areas difficult to isolate, like when you're dealing with class 5 lesions, you can opt for amalgam because amalgam is not as technique sensitive as newer materials such as composites. Large lesions, when you're dealing with large lesions, you can opt for amalgam because already amalgam requires the removal of a large amount of tooth tissue. So if this large amount of tissue is already gone, dental amalgam can be used. And also economics. This is important because dental amalgam is relatively cheap compared to the newer restorative materials such as GIC, RMGIC, and composites. So when cost is a problem, one might opt for dental amalgam. Contraindications. When do we not use dental amalgam? Like I mentioned earlier, aesthetic zones. We do not want dental amalgam anywhere near the anterior teeth. Areas easy to isolate. It's an area easy to isolate, easy to work on. Why go for amalgam? Small to moderate lesions. So why is this a contraindication? This is because tooth preparation for dental amalgam is not conservative at all. You have to give it undercuts, and it requires extension for prevention, which takes a lot of tooth tissue, so we don't want that. And also grossly decayed teeth, because we need tooth structure for the retention of amalgam. So if most of the tooth structure is lost, amalgam is not a good choice. And of course, if the patient has any sort of allergy to amalgam, in fact, when dealing with any form of material, you don't want, if a patient reacts to any form of material, you don't want that material anywhere near the patient's mouth, not just amalgam. And to sum up the video, just a few recent advances. That is all for this video. I hope you enjoyed it. If you did, give this video a like. If you want to see more, consider subscribing, and I'll see you guys in the next one.